Good morning from the American Academy of Ophthalmology Conference in Chicago. We're pleased to be here with Dr. Michael Snyder from Cincinnati, Ohio. Thanks a lot for being with us today.
Thanks so much for having me here. It's a pleasure to be here.
I'd like to speak with you this morning about some interesting novel imaging techniques that you have spoke on about slit lamp imaging in the office. Can you explain for us what these new imaging modalities are and how they're helpful for us clinically?
Well, for me, slit lamp imaging is part of my regular day and part of how I care for my patients, and it's really crucial for many of the things that I do. We have a couple different systems that are available to us. I have in one of my clinical exam rooms a Haag-Streit BX slit lamp, which has extraordinarily high resolution and can capture images with even single cells circulating in the anterior chamber, and in fact can even be blown up to wall size if one wanted to, and gives me great kinds of resolutions for publications or for other clinical needs as well. In my other room, I have a video-based capture card within the Haag-Streit BQ slit lamp that allows me to image with the slit lamp, and it gives me a couple of other wonderful options too, because while I am imaging, my patients and their family are able to look at the monitor and see exactly what I am seeing through the slit lamp. It captures the last 30 frames after I click the button to capture the picture, so I can actually go backwards. Sometimes if we're trying to capture a really good picture of a particularly important piece of pathology, we click the button and maybe the patient jumped or blinked right at that moment, and we don't get quite as good of an image as we want. With this system, it's got a memory key, and I can go back through the last many seconds and select in retrospect what was happening at the moment I clicked the button or I thought about clicking the button rather than when the actuation actually occurred. It's particularly useful in patients with nystagmus because sometimes if we capture a sequence of still images off of the video, we can see things that are hard to see on a high amplitude nystagmus exam at the slit lamp altogether, and with kids who are looking around, and these things can be super helpful. Now, even with our adult population, there's instances where I really depend upon slit lamp imaging. For example, people who come in with conjunctival neoplasia and they've got a tumor on their ocular surface. I document what that is at the very first visit. I often will treat these patients with topical interferon, and at each sequential visit, I'm able to compare pixel by pixel to the previous visit to see whether there's been positive forward motion or, perhaps worse, if there's been negative motion, in which case we would change our therapeutic plan. So that's a crucial component, at least in my practice. Corneal ulcers, similarly, it's hard to make a note in the chart that describes a corneal ulcer as well as a picture, and sometimes subtle changes from visit to visit can be hard to discern. With photography, not an issue. I have a special interest in the artificial iris world. And with the custom artificial irises, we actually need to take a picture of the patient's uninjured eye in the case of trauma, and we actually print that out while in the exam room so that they can compare that hard copy to what their eye looks like. And when the new custom device is manufactured, it's done from that hard copy picture. We do that all in the exam room with the patient present. So I don't think I could get through a full day without having my slit lamp imaging systems available to me.
These are some really great examples for us about how both still photography as well as video photography can really be helpful, and particularly I liked your description of being able to sort of go back in time a few seconds before you click the button to see what the frames looked like before you had clicked, to see if in case the patient blinked or moved or was startled. So I think that's a great feature. Thank you so much for explaining this for us today. It's always great to hear from your expertise.
Thanks so much for having me here.